Anna.
Hi.
Hi. Welcome to the feed.
Thank you. Thanks for having me.
Yeah. So why don't you introduce yourself and tell us a little bit about how did you get to Springfield?
Sure. Yeah. My name's Anna Hinman. I'm a physical therapist by trade, but I am the director of rehab here at Springfield Hospital. I started my career, I guess. I started college at University of New England in Biddeford, Maine, and strength and conditioning was my major. I didn't do the shortened version of PT. I wasn't quite sure what I wanted to do, but decided that was definitely the track I wanted to go. Did my 3 years at Sacred Heart University in Fairfield, Connecticut for my doctorate in physical therapy. I had one of my clinicals in the Upper Valley because I always knew I wanted to come home to New Hampshire. I just was telling you I grew up in Keene, so coming back home was really important to me. And I started working up in the Upper Valley in outpatient physical therapy for the beginning part of my career. And as we discussed a little bit, I then started my family and had to kind of look at what my priorities were and switch to home health. It gave me a little bit more of that flexibility in the schedule. It also gave me such a great perspective on patient care in the home instead of, what I was used to of patients coming into the clinic and a little bit higher level, at home. Usually they're just out of the hospital or just out of surgery. So it was definitely a different perspective. And home health is when I moved into management. Started managing PTs, OTs, nurses, some other like intake coordinators and schedulers, and then came into Springfield Hospital as the director, and I've only been there since February, but we've had a lot of great success since then.
That's amazing. I guess I think of PT as it's almost, because I've done several, it's
Yes.
going in and so having someone either manipulate my joints or making me do things like lift weights and walk and do things. How would you generally describe rehabilitation? What is the goal and how is it approached?
Well, I think physical therapy is incredible, and I'll say this about occupational therapy as well. Both careers, both jobs are really focused on the whole spectrum of your health. So we have gone from prevention, a lot of times we'll get patients come in pre-surgery to come in and get some strengthening for the lower extremities before they get their knees or hips done. But then we also see, you through the recovery. And so I think that's my favorite part about what I do, what we do, is that we really can kind of travel with you through your recovery and through your health and be there for all of those steps along the way. We do some manipulation, we do hands-on, we do some strengthening. My husband will tell you that I always ask him if something hurts. I said, did you do your exercises? You don't get out of it that easily. But you have to do the whole picture. So we do make sure that we're doing, some hands-on, some manual therapy. Sometimes that's necessary to loosen up the muscles, and sometimes you have to strengthen or stretch.
And how important is PT? You talked about like when people are having knee replacements or hip replacements. Why should they go? Basically, I know most people understand it, but let's hear it again. Why they should?
Yeah.
Things that can happen if they don't.
Thank you for asking that, because I think the important part of it is that you're getting this new prosthetic and this new knee or new hip, and you're so excited about the being bionic and like having that new part. But they do cut through the muscles. They cut through your very important muscles in both, for the knee and the hip. And you have to regain that strength. We have to decrease the swelling. We help decrease pain. A lot of times, you think of physical therapy as causing the pain.
I was just going to say increasing pain.
Yeah, causing the pain. But really, I always tell my patients who call to say, oh, I'm in a lot of pain today, I might need to cancel. I said, no, come to therapy. That is what our job is to make you feel better. It's not, yes, sometimes we have to cause the pain, but sometimes our job today might be just to get rid of swelling and make you feel better.
And range of motion is important too, because if I am understanding things correctly, like especially with the knees, if you don't get a range of motion in a certain period of time, you won't ever get that range of motion. Is that true?
Yeah,
Am I
our body
correct in that?
as it heals to where you are willing to put your body. So if you're not bending it to its full capacity, then you won't be able to, because the body's going to heal around whatever you're doing at the time. So that scar tissue really does start to build up, and it is important for you to make sure that you're working through that to get back the range of motion that you want and need to have in order to do things like stairs or get in and out of the car or just walk.
Because I would imagine that once people are feeling better, because they feel better, the pain's gone from, walking and things, they kind of think they're done.
Right.
Yeah. So I think
Yeah.
that's important
They do.
to remind people. I know that, because your whole goal of getting the operation is to become as functional as you were prior, and PT is a vital part of that.
Yeah, the inflammatory phase is really just the first step. We got to get through that healing, and then we can recover and we can strengthen and we can get back all the things, especially if we talk about somebody, who's getting a knee done. They probably haven't been able to do things they want to do for some time, and so we're not going to stop at where they were before the surgery. We're going to want to push through and get back some of the things that they couldn't do before.
That's a great way to think about it. To think about, you want to go back to where you were when everything was, you just don't want to be, okay, now I can move, but you want to move and do things that you liked to do before, like maybe playing with grandkids or,
Right.
Sports or something like that.
Absolutely. And I think that's a really important thing about physical therapy is, we mentioned surgeries and we mentioned the recovery after surgery, but I think it's important to note that we sometimes prevent surgeries. Sometimes you can go to physical therapy, and that's actually one of the most helpful things about PT is we can prevent you having to need surgery, whether it's for your back or your shoulder or your knees or your hips. We can't do much about joints that have fallen apart, but if there's an injury that we can help prevent, a lot of insurance companies will actually make you do PT before you get any imaging or anything done. Because of that, we want to prevent as much intrusiveness to your body as possible.
Would you say it's the whole, which side of the field is growing faster? Is it the dealing with replacements, or is it dealing with injuries?
Well, I would say replacements definitely take up a lot of our patient population. I think we have a huge population of people who are aging, and we also have incredible technology that allows us to have prosthetics that last longer. Once upon a time, they only lasted 10 years, and so you really didn't want to put it in at 50 because you would have to get it done so many times. But now we have prosthetics that last longer, and we have surgeons who really have come a long way in their ability to do these surgeries with minimal effort to your body, minimal impact on your body. And so I think we're getting a huge population of people who are choosing to have those joint replacements sooner, and we get to recover them. We get to rehab them.
I'm curious, so besides the obvious, the joint replacements, what are some other things that might cause someone to go to PT? Like, I think people don't think of PT.
Yeah.
They have, like, I don't know, my hips bother me a little bit or my back's bothering me a little bit, so I might take, painkillers and kind of mask it, where maybe a PT appointment would give you some exercises you could do, some things that you could do proactively versus medication. So what are some other instances of that?
Absolutely. I'll talk about the back in particular. I think a lot of our patients and in general, I'm sure we've all done that, where, something starts to hurt in the back and we ignore it. Now it's starting to go down our leg. Now we've got some numbness and tingling. Whereas if we do just go to physical therapy, get some exercises as soon as we can, we can help prevent it traveling further down the leg or having an injury that maybe was easy to fix in the beginning and now takes time.
I think that's a key is not, we talked a little bit, Dr. Cotter talked a little bit about this, how we just, she was talking about in her practice in gynecology, women kind of like, it's just something, it's just something going on, it's just aging, it's just whatever. And then by the time they actually come in, they've been putting up with something for a long time. So I imagine that you see a little bit of that too. So your message would be, Nope, you can get.
Yeah, to come in sooner.
Do you need a referral? How to explain
We do.
that
We
process?
do require a referral. Even if you don't have one in hand, we do schedule and try and work with your doctor to make sure that we get that. But in order to be seen on initial evaluation day, we do need a referral faxed from your doctor or hand delivered by the patient. Once we have that, we can set up for an initial evaluation, and then the physical therapist determines how often you should be seen and for how long. We also do reevaluations every month so that we know that we're staying on track and making progress towards our goals. And so we should probably talk a little bit about our locations because we can treat patients at both our Springfield outpatient clinic and our Bellows Falls here in Bellows Falls at One Hospital Court. We have an outpatient clinic as well, and we have
There's the locations.
there it is. We have currently three physical therapists and 3.5, even though she's not a half person. She splits her time between Springfield and here at Bellows Falls. So we have about 7 clinicians at our Springfield office and 1.5 down here at Bellows Falls. So we have started to grow the Bellows Falls clinic a little bit more. We have quite a few clinicians at Springfield, and we are just constantly busy in both locations, which is
That's good.
really awesome. We like to be busy. We like to treat our patients, and we like to get everybody better. So,
And talk a little bit about so occupational therapy. That used to be outside of the hospital, but now it's back in the hospital, so it's more convenient. You can talk a little bit about that, maybe.
Sure, yeah. So one of my first tasks in February was to take over. We took over our contract, and now we have an inpatient PT and OT that's Springfield employees full-time, and our occupational therapist, like you said, was down in River Street. We brought him up to the hospital, and we created this really lovely rehab gym.
Yeah, I do have a picture. They just have to probably cue it so I can get it up.
Okay, yeah.
We'll see.
No problem.
Maybe, maybe
I'll keep
not.
talking. It's well, you can't really see the occupational therapist section there anyway.
Oh, okay.
But either way, it's we took over the old cardiothoracic gym at the hospital and redesigned it so that we can bring patients from the IPCU down to do some parallel bars and stairs and work through the gym. And we also, in the back corner, have a section for our outpatient occupational therapy. So Dan Murray is our occupational therapist at Springfield, and he splits his time between outpatient and inpatient. So he does all of our occupational therapy right out of the hospital.
So that makes it more convenient for the patient.
It does,
Yeah.
yeah, it does. It's while it's great to have those outside locations, it is nice for the patient to just come to Springfield and know that they're getting treated there.
Nice.
How would you describe the difference between occupational therapy and physical therapy?
Yeah, I know a lot of times we get a little confused
people-
between the two, but I think they both deserve to have, as much credit for what they do. I think occupational therapists are incredible, very creative. They always have to figure out how to get somebody to do their normal daily tasks while improving the environment or improving the tools that they have to use to get it done. So basically, occupational therapists deal with the self-care. They deal with your daily tasks, like getting dressed or going to the bathroom or feeding, prepping meals. It depends on the setting that you work in as to how much you're doing, and how much to the environment that you're making changes to. But things like adding a thicker handle on a utensil, for somebody that has trouble gripping their utensils while eating, those are things that occupational therapists really focus on and truly get you back to those very important tasks of the day for hygiene, for feeding, and making sure that you can continue living, getting dressed, and then coming to see the outpatient physical therapist. Whereas physical therapy focuses more on kind of the bigger picture. So while we might focus on a particular joint, the bigger picture is, can you move? Can we move the ability?
More fundamental.
Right, exactly.
Yeah.
Can you move and can you get back to your fun tasks that you want to do, your fun activities? So very different in the ways that they approach things, very different in, I think, the people that you'll find that are occupational therapists versus physical therapists. But work very well together as a team, focusing on the patient as a whole.
And they all fall under the umbrella of rehabilitation. So that's why you
Yeah,
Yeah.
that is why I'm in charge of both PT and
So are
OT.
there other fields under rehabilitation besides PT and OT?
We do have a speech language pathologist
Oh, okay.
that is, contracted services right now. We don't have full time, but that would be under, director of rehab as well. And yeah,
So it's really much bigger picture than you might at first think.
yeah, it's not just physical therapy
Yeah,
for sure. Yeah, yeah, yeah.
And do you have plans to expand any of the? I know you said that we're expanding down here, and you contract the speeches. Or any plans to expand and have, or is it just it's working?
Yeah.
It's working well now.
Well,
the way
I
you have it?
think the important thing that, when I came into Springfield was because we wanted physical therapy, occupational therapy, we wanted rehab to be one of the core services of Springfield Hospital. I think Bob Adcock, our CEO, and Lori Profata, our COO, recognize that rehabilitation is very important for the whole, like we talked about, the
Yeah.
whole spectrum of health from prevention to recovery. And so it is one of our core services at Springfield Hospital, and it is something that when I came into the picture in February, the goal was growth. The goal was to
Good.
really focus on how we can help the community as much as possible.
Now, are you running into the same thing in your department that pretty much everyone in healthcare is there? Is it hard to find people? It
Always.
seems like everywhere,
Everywhere.
every
Yeah.
aspect of healthcare, it's really hard to find folks.
It is.
So if I'm getting a little off track, but if somebody was watching and they were maybe in high school or maybe looking for a secondary career, what recommendation would you give them if they were interested in either of these professions? How might they go about? Because you can be a PT assistant as well. Right?
Absolutely, absolutely. So that is how I wanted to be a PT. I actually went to PT for a knee injury and was like, this is really cool. I want to do this for my career. And I was in high school, and I started as a rehab aide, which is something that anybody can do in a clinic. You don't need a degree. You can be in high school. And you just help the therapist, clean up the gym or clean up tables and help with some exercises that you can walk through. You can also go on to become a physical therapy assistant, which is only a 2-year associate's program. So you can go right out of high school and get that associate's degree. You can then decide to be a physical therapist, which is a 6 to 7, depending on if you do a fast track program, but it is a doctorate degree, so you do have to go into grad school for that. But there are a lot of ways. I mean, and occupational therapy is, I believe right now, is a 2-year master degree, 2 years after your 4 years of undergrad. So it is a lot of schooling to get there, but definitely, looking at it as a possibility, for a career is.
Well, I think that it's definitely, I think younger folks now are needing to focus on what's definitely going to get me a job
Yeah,
when
job
I get
security.
out.
Yeah.
And
Yeah.
so this seems like especially if someone's interested, if started out like yourself, kind of interested in the fitness component, strength and conditioning. We do have a fitness center here in town. So if somebody right up the hallway here in Graz, if somebody is like into that realm, but they want to go to the next level, that would be a great, and it seems like there's a demand.
There is
So-
always a need for physical therapy, occupational therapists. There's always, you can work in a bunch of different settings. So that is also the cool part. You can work in an outpatient, you can work in home health, you can work in inpatient, you can work in a school. There are a lot of different avenues that you can take for therapy as a career, which gives you that job security and just knowing that you're always going to be able to find something.
Good. Well, hopefully we inspire somebody.
Yeah.
And hopefully they apply
And
at Springfield.
apply, and in
you
about
have-
7 years,
exactly.
I'll be looking for your application.
No time at all. No time at all. So we're down to just a little over a minute. So just walk us through the process of how we get into a physical therapy appointment and where we might go.
Right. So like we talked about, we do need you to go see your doctor. They need to know that you're having a problem that we need to help with, and then they'll send us a referral. They can fax it straight to our clinics, depending on where you want to go. And then you can give us a call if you haven't heard from us. Usually when we receive a referral, we are calling you to schedule. But certainly give us a phone call if you haven't heard from us. We'll get you on the schedule. You start with an initial evaluation with a physical therapist, and then we set you up for visits for as long as we think you need based on your injury to see. Yeah. And we've got Springfield location is our outpatient at Springfield Health Center on 100 River Street. And we also have here at One Hospital Court, we have our Bellows Falls location as well.
Perfect. And
Right.
your advice is sooner rather than later?
Sooner rather than later. I can't fix what I don't know is broken.
Perfect. Thank you so
Okay,
much.
thank you so much for coming on.
Thank you. Thank you so much for having me.
Okay,
You're welcome.
that's it for this week. We'll see you next week on the feed.